not that fold, here. And then I gently, you have pictures of step by step of this in your paper things as well. My fingers only come through my sleeve once my hand is inside the glove, okay? All fingers through. This is why your hands have to be super dry. That's it, I leave it. See, my sleeve is all the way up on my palm, perfect, not a problem. Now, with my right hand, I go into the pocket here. If I need to use this hand to put this down, keep it down, I do that. But I go in the pocket now. Now I gently put my fingers in the glove. Fine. Wiggle through. Take your time. Don't rush, don't panic, don't stress. Because if you rush, if you panic, you stress, then you make a hole in the glove. Just know what is sterile, what is not sterile. Everything out here at the moment is sterile. You can touch everything. It's your hand on the inside that is just clean. It's not sterile. Skin cannot be sterile. Okay? So now, I pull it up. Pull it up. Look, if you need to pull up your sleeve a little bit, do that. But it shouldn't really go any further than this. Your sleeve should be on the palm of your hand, back of your hand. Why? Because this is normally not that elastic. So if you pull up your sleeve all the way to here, during surgery and movements, this could go down, the sleeve can come up, and suddenly you're exposing your wrist. This is also a bit extra. It feels nice. Once you get used to that, you can't do anything without having that extra feeling. It's mental memory. Now you go in with the other hand into that pocket, and now you'll be pulling this up. And then pull it a little bit. Great, we're done. And now I'm waiting for my scat nurse. So what do? I stand like this and pray that everything's going to go well. Okay? Now, are these latex free or are they latex? Sorry.
That means it's free.
Yeah. Okay. So now we go back to this. So now I'm all ready. I'm all done. Now I'm coming here. Now, for me, now that I'm clean, I go on the inside. I don't go on the outside. Scat nurse on the outside, clean nurse on the inside. You just have it as a habit. You go on the inside, they go on the inside and roll it up. In that room, have you put the blue tags on the wall? Yeah. So if your big surface is against the wall, what I recommend is that if you have a big sheet like this, you go from inside, and remember, all on the inside, this is all sterile, so I can touch all of that. Then I go against the wall like this, not all the way full out. Do you want to come and show how you would do that? Then the scat nurse takes the edge. So yeah, so you take the edge and then you can tape it on the wall. So you end up, because this bit is not going to be in the surgical area, but now you have covered the wall with sterile as well.
And you can push it onto the...
Yeah. Here you can push it onto the blue tag. So we've put blue tags on the wall, which is what you can do in your practices as well. Push it onto the blue tag, or I can push it onto the blue tag as a sterile nurse, and then you can get the scat nurse to put tape on just for insurance so that it doesn't, in the middle of surgery, doesn't fall onto your thing. But if you have a tray separate like this, then you make it fall, and the scat nurse sits on the floor as we talked, and just pulls the sides down. So the scat nurse here can help, and the scat nurse takes everything down on the sides. Does that make sense? Hold on. Okay. Then I cleaned up over there. I have that, my gown's sheet that is clean, that is sterile on the inside. I put this is the surgeon's gown and towels, onto that sterile on the other side. Does that make sense? So that's all clean. Then we have the parts here. Depending on what kit you have, these are the stickers. I like the stickers on the areas where you want it to be see-through. I don't like using these on handles because they just it's just so difficult. This is the patient's ones. This goes on the side at the end. Now go through your pack and see what you have here. Okay, so I have another sheet here that I can put on my third surface, and it has a sticker. I utilize the sticker. Now, because it comes folded like this, I know that it's not super big. Because if it was big, it would be unfold it, correct. So still, I still don't know really how big it is. Okay, let's see how big it is. Okay, so I need to be in control. Okay, so I can see the edges. Okay, so it's not that big. Where am I going to put it? How am I going to put it? If you're just going to put it over a table, then you don't need to think about the sticker. I'm going to show you where I would use a sheet like this. We're using it on a motor where you use the sticker to stick it on the motor. We go through that. I'm going to show you these now. With this particular pack, you get this for your section. This whole thing is sterile, so you don't need to cover it. This is all sterile, okay? Now you have to, with the pack that you ordered, open one, get them to send you a trial pack and see what connections they have in there, because every surgery is different. Now for our surgeries here, for all of them, the way this one goes into the small section, and this one, if you want to use this one, then you have to connect. You have to put the white connector into the extra blue connector that you have, and then put the blue connector here. Because everything is sterile, I can do all of this. Now I can hand this over to my scalp nurse, this end, which she puts in there, and I put this, and I put the suction right here. Now let's pretend that this is the attached suction tube that we have in the surgery. So let's pretend that this is your big tubing, and it's connected. And so none of this is sterile. So okay. So I have the suction holder here. Now that is not sterile. So if I wrap this, I can't put it back on there because that's not sterile. If I have the patient in the chair, and I have draped the patient, and it has those two holes, I can do this and straight away put that suction wrapped onto the patient's chest. If I haven't done that, then utilize what you have. If you don't have bigger sterile bags, then use this one. For our purposes, you can use this one. You put that over the suction, the end of that suction holder that holds the suctions. Do you know which end I'm talking about? I'll show you when we go in there as well. You put that in there. This is all sterile. So now I can connect. I can what is it called? Cover that. Okay, so that's not sterile, but I'm sterile. I'm holding this. Yes, we use everything. We use two hands for everything. Make sure. This connection is super important. You don't want this to come loose in the middle of surgery, which happens.
You're really strong, by the way.
And I've heard that.
You pushed me over.
Yeah. Sorry. I've heard that. Okay, this comes with two stickers, and of course I took the wrong one. Okay, these are super cool. You just put this in. Now, the tape has to be above the junction, about here. The tape, you can't tape it down here. It has to be above here. Now, I know we have that extra tape. Let me put that extra tape. Put that extra tape here to make sure that it doesn't come loose. Okay?
Touching the inside, so.
Yes. Now, I can touch above here, but Haley, your scalp nurse, can actually grab this and pull it down while I'm holding up here. Okay? So now about this much of it is sterile. It's going to be around here when you're touching it. But that down there is fine. I really like these. These are probably the best ones. Well, I didn't know how to use them last time, so I just completely messed it up, but this time Haley showed me how to do it. Okay, one more thing before we go over is the two things actually. The patient one. This is the one that I told you about the stickers. Can you see that? This is the bit that goes around on the chin. Okay? So this is a big one. You know that it's going to cover the patient from top to toe, so it's going to be big. Now what do? The patient is lying in the chair, and I can at the moment touch all of it. So I know that this bit is head, and I'm holding half of that. When you unfold an unknown sheet, you don't know how long it is, always hold the end of it in your hand as well, so it doesn't just drop on the floor. See how you gently, when you gently open it, you're in complete control. And here you hold it. You know that you can hold this. You're allowed to hold this because all of this is at the moment sterile. Okay, so I know that that's halfway. So that's as long as it goes. Okay. Now, there are stickers that says up and down, but sometimes they're more confusing than helpful. You know that this bit is going to be at the top. Okay. So this bit has to be at the bottom of the patient. It's going to go to the feet. So then I stand here, and you have a few folds here. So I just go, okay, so maybe I hold on to this much at the top. The rest of it seems like it's going to go reach out to the feet of the patient. So my scapners come to this end. Patient's head is here. I'm standing here. I've put this over the patient on each side of the patient. Now in the chair. Patient is lying down. I reach out like that, and then that's it. Yeah. Okay, so now I slowly give more. Okay, well I can give more. I'm constantly in control. I'm not dropping anything. Now, can you see that the surface changes? Now we have shiny surface on the outside, not this one, which means that my scapners can touch this now, because this is going to touch the patient. Okay, so now I'm going. Okay, so the patient's head is here. I want to put the sticker on the patient's neck. Now, not neck, the patient's chin. Now, I can remove this. This is still very sterile. I can remove this, put it on the patient's chin, and then I go on the inside. I go on the inside, I go on the inside, and then Haley, I think
I'll be the patient.
you want to be the patient?
Well, I'll pretend.
Yeah, but you know, because now your scapners can touch this side and move it over. We tried to have this demonstration in there, but it was, can you imagine all of you surround? So we are going to do this, all of you are going to do it there. I just want you to have an idea of how it's done. And you have all the pictures here as well. Then you have the tapes on the inside, which the scapners can then open, and tape on the side of the patient and goes over the patient's head. And these are the holes that I was telling you about the suctions. Now one last thing, and then we go in and we try. Let's do the Mayo tray. Now, the different sizes of Mayo trays and the different sizes of sheets. So make sure that you have the right size in your pack for the Mayo tray that you have. It's all written on the outside what size it is. Gosh, this is hot. You have the plastic side, and then you have a bit of fabric. Which side is up, which side is down, do you think?
Plastic down.
Plastic is down, exactly. Now, these are the hands that we're talking about. There is a little pocket in here. Okay, so I put my hand here, I put my hand here, and I'm moving here, and I'm going, okay, so pocket, pocket. It's fan folded, so nothing is falling out. Now, my scapners takes the inside, yes? And I am holding on to this side. I'm holding on now to the end of this, and gently, so she's only touching the plastic bit. She's not touching the inside. We are unfolding it. Done. I love this. This is so good. And then it's a perfect bean bag at the end of the surgery. Try this. This is a bit tricky, but it's fantastic. Once you get your heads around it, this is the one that I used for covering, that unit where you have your pieces coming in. You can do exactly the same thing with that unit. Okay, let's go in there and let's practice. So we want